Hey everyone, welcome to the Explainer. Okay, let's jump right into this, because today we're unpacking what is absolutely the most researched, yet somehow completely misunderstood supplement on the planet. I'm talking about creatine. For decades, it's been boxed into this very specific, kind of narrow category. But based on the mountain of medical and fitness data we're reviewing today, we're going to completely rebrand this stuff. As you'll see, it really operates as an ultimate health and longevity tool. So let's just address the elephant in the room right off the bat. Is creatine only for bodybuilders? I mean, I know exactly what you're probably picturing right now. Massive guys in the gym, slamming shaker bottles, practically lifting cars. It has this deeply entrenched meathead stereotype. But we're going to disarm that skepticism right now. Today, I'm taking you on a top-to-bottom tour of your body to show you the truly surprising systemic benefits of this compound. Spoiler alert, it is definitely not just about biceps. It's about your brain, your heart, your bones, the whole shebang. Look, before we talk about what it does, we kind of need to understand what it actually is. Creatine isn't some weird synthetic lab chemical. It's just a naturally occurring peptide. If you think back to high school biology, amino acids form proteins, right? Well, when they form tiny little chains, they're called peptides. Creatine is literally just a small chain of 3 amino acids: arginine, glycine, and methionine. Your body is already making it in your liver in small amounts. From there, it gets stored in your muscles, which, we'd expect. But crucially, it's also stored in your brain. And that brain connection, that's where things get really fascinating. Okay, here's our roadmap for the explainer. 1. What is creatine? 2. Superpowers for your brain. 3. Muscles and physical performance. 4. Heart, bones, and hormones. And 5. Debunking myths and doubts. We've got a massive amount of dense medical data to get through over these next few minutes, so let's dive in. All right, Section 2. Superpowers for your brain, beyond the brawn. So creatine actually acts as a legitimate nootropic. It's a cognitive enhancer. The source data shows it profoundly improves executive function, the part of your brain that handles decision-making. It boosts short-term and working memory, basically your ability to hold on to information while you're actively using it. It even ramps up your raw processing speed. But I really want to highlight this fourth point, reversing brain fog. You know that incredibly frustrating feeling when you just can't concentrate or find the right word? A lot of us dealt with that after the events and infections of 2020 and 2021. Well, studies show creatine directly combats that symptom. It helps clear the fog and gets your mental sharpness back online. And this leads to a super practical, everyday benefit. We've all been there, right? You get a terrible night's sleep, but you still have a massive exam or a huge presentation or just a brutal workday ahead of you. Normally, your mental energy just tanks. You exhaust yourself just trying to stay focused. But the research shows creatine actually maintains your brain's base mental effort. It acts like a cognitive reserve, stopping that rapid mental exhaustion when you're sleep deprived. It's basically a safety net for your brain's battery. Okay, Section 3, Muscles and Physical Performance. The engine room. The really crucial takeaway here is that creatine protects muscle tissue across completely different physical disciplines. Let's break this down. For endurance athletes, like marathoners or triathletes, creatine actually reduces muscle damage by lowering this thing called tumor necrosis factor alpha, or TNF-alpha. When TNF-alpha builds up, it causes cell death and inflammation. So lowering it, that means faster recovery and way less pain. Now, if you're an intermittent faster, this is a real game changer. It preserves your muscle glycogen stores, meaning you can train hard on a completely empty stomach without losing your power. And for older adults, over 65, it is absolutely vital for preventing sarcopenia. That's the age-related muscle wasting that causes so many issues. Creatine helps keep you independent and resilient. But, yes, it definitely also makes you stronger. Studies consistently show an 8 to 14% increase in maximum strength and physical performance just from taking it. And if you're someone who's always struggled to gain mass, maybe you've got one of those super fast metabolisms, the source material points out an amazing hack. Try pairing creatine with 2 grams of the amino acid beta-alanine. That specific combination massively boosts muscle growth and strength compared to just taking creatine on its own. So how exactly does it help you keep going when you feel like you just want to quit? Well, it all comes down to your lactate threshold. That's the exact moment during a workout where your body starts making more lactic acid than it can clear out, which gives you that awful muscle burn. Creatine increases your body's stores of ATP, which is our primary energy molecule. By having more ATP ready to go, your body delays tapping into its other reserves, which effectively pushes your lactate threshold higher. In plain English, your muscles take a lot longer to burn out. All right, Section 4, Heart, Bones, and Hormones. The systemic shield. Let's look at what this does for your cardiovascular system. Supplementing with creatine actually reduces your triglycerides and lowers LDL cholesterol. On top of that, when you combine it with a standard multivitamin, it lowers homocysteine. Homocysteine is a substance that can damage your blood vessels, especially the really delicate ones up in your brain, and it tends to spike if you eat a lot of animal protein. Creatine helps keep that totally in check. It also boasts nitric oxide, which visibly improves blood flow and capillary dilation in your forearms and calves. That means a lower overall workload on your heart. Now, if you care at all about longevity and vitality, you really need to pay attention to this number. 15. That is the average percentage increase in testosterone levels that studies observed when creatine was combined with resistance training over a 10-week period. Look, in a world where baseline testosterone is dropping across the board for both men and women, this is huge. Optimizing your hormones naturally through training and creatine is a massive step for your longevity. It's just so much better than jumping straight into hormone replacement therapies if you don't absolutely have to. Next up is your structural integrity. The source highlights a 12.3% increase in bone density found in rat studies. Now, sure, animal studies don't map perfectly one-to-one with humans, but the mechanics behind this make perfect sense. For us, the bone benefit is largely indirect, but it is incredibly powerful. When creatine helps you build stronger muscles, those muscles pull much harder against your bones whenever you move or exercise. That mechanical traction literally forces your bones to adapt, remodel, and grow denser, which is exactly what you need to ward off age-related frailty. Section 5. Debunking myths and doubts. Fact versus fiction. I can almost hear the hesitations right now. If this stuff is so amazing, why are there so many warnings about it? Myth number 1. It destroys your kidneys. Here's what's actually going on. When your body uses phosphocreatine for energy, the natural byproduct is something called creatine. Your kidneys naturally filter creatine out of your blood. So obviously, when you take creatine, your blood creatine levels spike. A lot of doctors see that elevated marker on a test and just assume your kidneys are failing. But if you're healthy, this spike is completely normal. You simply have more of the raw material in your system. Decades of continuous studies show absolutely zero kidney damage in healthy people taking standard doses. All right, myth number 2, creatine makes you go bald. This one's actually kind of a trick question. We already established that creatine boosts testosterone. In the body, testosterone naturally converts into a much more potent hormone called DHT. Now, if that DHT accumulates, yes, it can cause hair loss. But here's the catch. You only accumulate DHT if your liver is struggling to clear it out. The problem isn't the testosterone spike at all. It's sluggish liver clearance. So the source material actually suggests looking into a natural liver cleanse rather than missing out on all the amazing benefits of this supplement. And myth number 3, you need to cycle on and off it, and it causes horrible water retention. Completely false. These are just old myths left over from 1970s bodybuilders who were taking like 4 to 5 times the normal dose. The scientific consensus today is perfectly clear. There is absolutely no need to cycle it. Constant daily use is totally safe. And at a standard dose, it draws water directly into the muscle cells, which is exactly where you want it, rather than causing that puffy, systemic water retention under your skin. Moving on to our final section, how to take it, the optimal protocol. So, how do we actually use this? The protocol is incredibly simple. First, the magic number is a standard dose of 5 grams daily. Technically, you can get creatine from natural sources like herring or fatty fish or pork, but you'd have to eat physically impossible amounts every single day just to hit that 5-gram clinical dose. So honestly, a powdered supplement is the way to go. Second, take it in the morning or right after your workout for the best absorption. And third, and this is super important, do not take it at night. Remember that cognitive energy reserve we talked about earlier? Taking it right before bed gives your brain an energy spike that can really mess with your ability to fall asleep. The source data also points out how easily you can adapt this protocol for your specific needs. If you're over 65, it's recommended to combine your creatine with essential amino acids or a high-quality whey protein. That just makes sure your aging muscles have all the raw building blocks they need. If you struggle to digest proteins, try taking it with digestive enzymes or proteases. And if you're recovering from an injury, or maybe you're just getting into fitness later in life, try pairing your creatine with super slow training. Basically, you use just 55% of your normal weight, but you make every single repetition last an agonizingly slow 15 to 30 seconds. It triggers massive muscular adaptation, but keeps the risk to your joints incredibly low. Which brings us to our final thought. We've seen how this one compound upgrades your memory, clears out brain fog, builds a fortress against muscle wasting, protects your blood vessels, and optimizes your hormones naturally. We've completely stripped away that outdated meathead stigma to reveal what is essentially a profound, thoroughly researched longevity tool. So, knowing all of this, why aren't you taking it? Thanks so much for joining me for this explainer. I really hope this empowers you to take charge and optimize your health. Catch you next time.